Hello beautiful ones, I'm just coming on here to update you with the latest treatment for mastitis. Just a few really important things. If you are breastfeeding or you are starting your journey in breastfeeding, most important thing is that I say to everyone is just always making sure that you examine your boobs. So have a look in the mirror in the morning, lift up your arms, have a good look to make sure there's no red or inflamed areas, all right? Because it's really, really important that we get on it quite quickly, which means then it won't progress. So first of all, the most important thing is to know, signs of mastitis can be, you kind of get flu-like symptoms, you might get hot, a bit of a temperature, and you might get a firm, swollen, hard kind of area, red, inflamed. Okay, so those are all kind of signs and symptoms of it. Some come with bits of that, and not all of it. So the most important thing to say is put some ice on it. So first thing you do is think of it as it's inflammation. We need to cool it down. So it's really, really super important to put some ice on it. So you can ice up to every hour or more if you want, and it should become quite soothing. Okay, so some peas wrapped in a muslin is absolutely fine, but you might find other ways of doing it, or gel packs, and pop them on. That's the first thing you would do. Things like ibuprofen for an anti-inflammatory, again, works exactly the same as like when you use the ice, as well as something for the pain. So if you are getting pain with it, you probably need some Panadol or paracetamol. So now massage, we used to discuss massage. Now we're going to talk about just very smooth sweeping movements up to the lymph nodes. All right, so it's really, really important to just get that drainage into the lymph nodes, and we're not digging, we're not using vibrators, we're not using vibrating toothbrushes, we're not digging, we're not doing anything like that. Super, super important to, in the research paper they suggest like stroking a cat. So if you do like real gently stroking a cat, that's exactly what you're going to be doing up into the armpit. Okay, so you're going to come up here into the lymphatic drainage system up here into your armpit. Okay, so it's really important that you do real gentle. All right, in the shower, you may find you love the shower, but that's soothing, but that's absolutely fine. But really, really important is to remember the ice. All right, so it's not a problem. It might feel really lovely going in the shower and getting that lovely warmth on it, and that'd be comforting. But afterwards, get that ice on it to really just bring that that inflammation down. Now, another really, really important thing is feeding. So what we want you to do is feed on demand as you need to. I don't want you overfeeding. I don't want you pumping. If you never pumped before and you've got mastitis, you don't need to pump. It's all about just getting the baby on to feed when the baby feeds. All right. So we don't have to empty that breast, because otherwise what happens is we actually tell your breast to make more milk. So we don't want to do that. All right. So it's really super important to just feed when your baby needs feeding on demand. Or if you are pumping and you've only ever pumped, then just pump routinely like you were. Don't change it up, don't increase it. All right. I'm just checking to see if anything else. I suppose the one really very important thing is to know that what physiologically is normal when you are breastfeeding, and you'll all notice that there, I'm sure, that when you breastfeed, oh my goodness, you sweat, like really sweat. You've probably never sweated, I don't know if that's the word, like this in your life, but it's very normal. So that isn't a sign of a mastitis. If there's nothing else, it's very, very normal. And sometimes you get these real hot, like kind of flushes. That's very normal too. So as long as everything else is all right, that doesn't indicate that you have any underlying possible infection. Now, if after 24 hours of you doing the ice and the anti-inflammatories, and you've taken some paracetamol, and you're doing all of those things, if after 24 hours you're still feeling like it, then that's the time to pop along to your GP and have a chat. Now, lots of times mastitis doesn't need antibiotics, but so especially if we get on it early and do all those things. So I hope that helps. Reach out if you need any support. All right, take care. Bye.